right, in this lesson, we're going to talk specifically about leukemia. Now, you may or may not have heard of this before nursing school, but we're going to break it down for you and give you the most important things you need to know. The first tip is that leuc or leuco usually refers to the color white, and then emia refers to blood. So we know somewhere in here we're referring to white blood cells, right? Okay, so leukemia is a cancer of the bone marrow. Remember, the bone marrow is responsible for production of all of our blood cells, including red blood cells, white blood cells, and platelets. But leukemia primarily involves the white blood cells. As that cancer takes over, we begin to see excessive production of white blood cells. The problem is that they are abnormal, they're underdeveloped, and they're immature cells. So they can't actually perform and function like a normal white blood cell. Now, what does a white blood cell do? Let's remember, it is entirely responsible for our immune system and fighting off infection. So if all of the white blood cells that we have are abnormal, undeveloped, immune, then we're not going to be able to fight off infections. We're not going to be able to heal wounds. We're not going to be able to take care of our immune system needs. And then you can also see here how there's this shift towards excessive production of white blood cells also hinders our production of red blood cells and platelets. You see there's a lot fewer red blood cells because the bone marrow just continues making these immature white blood cells instead of everything else. So how do we diagnose leukemia? Well, first we're just going to see the clinical picture, okay? The problem is that the clinical picture you're going to see is pretty nonspecific. We'll look at that in just a second. But when we combine that with our CBC, or a complete blood count, and we get a white blood cell count that is excessively high, then we're going to know that that's what's going on. So we always want to get a differential. The differential is when we can break down all the different types of white blood cells. So, you've got lymphocytes over here. You've got basophils, neutrophils, eosinophils, monocytes. These are all types of white blood cells. So what happens is we break this down and we see a large production of either the lymphocyte type cells or these on this side, which are myeloid cells. So you see these excessive immature cells. So there's two types generally, and then each one is categorized into acute or chronic. So there's acute lymphocytic leukemia, which would be the lymphoid side of things with the lymphocytes, and acute myelogenous leukemia, which would be on the myeloid side. So again, basophils, neutrophils, eosinophils, and monocytes. And then either of these can be acute or chronic. So acute lymphocytic, acute myelogenous, chronic myelogenous. Now, you can also do a bone marrow biopsy. And again, this just gives you more specific focus on the cells themselves to see the official diagnosis of those cancerous cells. Now, these are in order of the severity and the age range that we usually see with these patients. And so acute lymphocytic leukemia, we're usually going to see in children, usually under the age of 15. Chronic lymphocytic leukemia is most common in the elderly, usually ages 50 to 70. Acute myelogenous leukemia, or AML, usually peaks at about 60 years old. And then generally CML, or chronic myelogenous leukemia, the risk increases with age. Generally speaking, acute is more serious than chronic, and acute myelogenous leukemia is more serious than acute lymphocytic leukemia. So of all of these, AML is actually the most serious. When it comes to symptoms, again, they're very non-specific. They're very generalized, but there's a few things that when you kind of put them all together, it really can click for you that something isn't right. They're going to have weight loss and fevers and frequent infections. And then, of course, along with these fevers, you're going to see night sweats. Again, that's pretty general, right? But combine that with these next few and a light bulb should go off for you every time. That is pain in the bones and the joints. Why? Because it's cancer of the bone marrow. So they're going to have achy bones. And then because the bone marrow isn't functioning properly, we're going to see aplastic anemia where they aren't producing red blood cells or platelets correctly either. So we're going to see anemia. So we'll see pallor, fatigue, those signs of anemia. We're also going to see easy bleeding and easy bruising. This is thrombocytopenia. If you want to learn more about that, go back to the thrombocytopenia lesson and watch that. So when you have a patient who comes in and they have these general symptoms, kind of have some infections, maybe fever and night sweats, they're really achy, and also they have these bruises that they pop up like almost overnight. They don't remember bumping into anything. They don't remember getting hurt, but now they have these bruises that just won't go away and they won't fade. This is when you start putting these pieces together, and that's what starts getting people looking into these diseases. Now, in acute leukemias, you'll see white blood cells actually end up dropping because of how quickly the disease is progressing and they're losing those white blood cells. In chronic, we're going to see this excessive production and they're still going to be kind of hanging around. Okay. Those are just things to note for your CBC with differential. Now, in terms of management, the primary treatment for leukemia is going to be chemotherapy or radiation. Later in treatment, some patients may be eligible for a bone marrow transplant as well. Now, the primary purpose of chemotherapy and radiation is to target and kill the fast-growing cells. So that would be like the overproduction of white blood cells. The problem is it also kills healthy, fast-growing cells like hair follicles and things in mucous membranes. And so they have quite a few side effects from the chemotherapy, like nausea and vomiting, hair loss. They might have mouth sores. Some people even call this chemo mouth. So we want to make sure that we're taking care of them. We put them on neutropenic precautions because of the decreased white blood cells. We put them on bleeding precautions because of the decreased platelets. Now, neutropenic precautions are something that the CDC says we don't really need to do this anymore. But what we want to do is make sure we're avoiding things like fresh flowers. So no fresh flowers. We want to limit the number of visitors. So we don't have to do reverse isolation. We don't have to wear a gown and a mask before we go in the room. Most of the time we do, but the CDC says technically that's not necessary. But what they do want to make sure we do is avoid bringing in germs and bacteria from the outside, which would be the fresh flowers and decreasing visitors. They also need to be on bleeding precautions, just like with thrombocytopenia. We also want to provide frequent rest periods because of the anemia and the fatigue, and the oral hygiene because we know they may have these mouth sores. We want to do really, really good oral care because open sores in the mouth are a huge source of infection getting into the bloodstream. So oral hygiene is super important for leukemia patients. Okay, so our priority nursing concepts for a patient with leukemia are going to be cellular regulation. We want to deal with the excess production of white blood cells, infection control because we know they're at risk for developing infections, and clotting because we know that their red blood cells and platelets are low as well. We want to support them through chemo, their bone marrow transplants, prevent infection, and use bleeding precautions to prevent injury. Okay, let's recap. So leukemia is a cancer of the bone marrow that results in proliferation or excessive production of immature, undeveloped white blood cells that cannot function like they're supposed to. It's classified based on whether it affects the myeloid or lymphoid cells and whether it's acute or chronic, with acute myelogenous leukemia being the most common and the more severe. Patients are going to be at high risk of infection, and they're going to experience aplastic anemia. So they're going to be weak, tired, achy. They might be pale, and they might bruise easily. So we need to keep an eye out for that. Again, those general symptoms plus these types of anemic, bruise easily things are going to be really your clue that this is a leukemia situation. Remember that chemo and radiation's goal is to kill fast-growing cells, including healthy ones. So we need to make sure we manage their patient's symptoms. And then we're going to put them on neutropenic precautions to keep them from getting infections, put them on bleeding precautions, and make sure we do really good oral care and take really good care of their oral health. And of course, anytime we have a patient at risk for infection, our number one intervention to decrease infection is going to be hand hygiene. So those are the basics of leukemia. Make sure you use all the resources in this lesson, including the care plans and the case study, to learn more and put the big picture together for these patients. Okay, guys, go out and be your best selves today. And as always, happy nursing.